Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Nawaz Habib.
Hi, everybody. It's Dr. Habib and JP here. How are you, sir?
I'm doing great. Thanks.
I'm excited to chat about this topic today. This is the underlying effect of autonomic dysfunction and the idea that this is a missed piece in a lot of these seemingly unrelated symptoms and diagnoses that people tend to be diagnosed with multiple diagnoses, multiple issues, multiple chronic diseases at the same time, or having symptoms that seemingly are unrelated when in fact, if we look at it with the right lens of autonomic dysfunction being kind of along the root of this, can often be attributed to this particular dysautonomia piece or dysfunction of the autonomic nervous system. Let's do a little bit of a basic kind of overview, just quick reminder for everybody when we're talking about the autonomic nervous system, exactly what it is we're talking about.
Yeah, the autonomic nervous system is the aspect of your overall nervous system, central and peripheral, that controls all the things that you don't manage consciously. So, how fast your heart is beating, how fast you're breathing, your digestion,
Body temperature.
Body temperature is a great example. And what we've determined is that some of the things that are kind of obviously controlled by your nervous system, like we've just mentioned, aren't the limit of what the brain actually really does control and what the nervous system does control. Other things that are controlled by your autonomic nervous system include inflammation levels, your immune system, metabolism, even at the cellular level, circulation. So all of these things that are really, even nutrient sensing that we get at the subcellular level is controlled by your central nervous system through your autonomic nervous system and the release of neurotransmitters and how those neurotransmitters affect both the extracellular and intracellular environment. And so the point that we're getting to today is talking about when that system isn't functioning properly and when there's a bias away from sort of that center homeostatic position that we want to be in, when you're pushed away from that into an overly stressed state, for example, that you start to experience symptoms. And I think we've spent a lot of time on this podcast talking about some of the various different medical conditions that are associated with this chronic state of being in this threat response mode. But there are some common symptoms that aren't mischaracterized as a medical condition, but they are symptoms of that underlying autonomic dysfunction that are common across all of these different conditions. And it's worth thinking about them and talking about them because there are ways for people who are experiencing some of those to recognize that they might be in a bit of a danger zone, might be in say that it's like driving your car and the warning light's on. You got a warning light on if you've got these issues cropping up.
Yeah, that makes a lot of sense. I like to simplify this autonomic nervous system out into almost like a dimmer switch or a slider between these two sides. And we're never truly in one or another. We are generally kind of bouncing between these in a very dynamic way. So the slider or dimmer switch analogy kind of makes sense here. We're always sliding between these two sides of the autonomic nervous system, whether we're more on the parasympathetic side, the vagus nerve activated, rest, digest, repair, recover side, or we're more on the sympathetic side, rest or the fight or flight specific side. And when we go off really deep end into that sympathetic state, that's where the threat response mode, the cellular danger response mode turns on. And the signaling is going to be far more driven towards hypervigilance and hyperinflammatory kind of capabilities. Where when we're more on the parasympathetic state and more the slider is kind of leaning in that direction, we're more regulated, we're more capable of staying within this rest, digest, recovery mode. Healing can actually occur within that mode, but we're not as vigilant to the threats that are around us.
Yeah, resilient, not stiff. You can imagine a person who's in threat response mode, hypervigilant. They're tense. They're, you get, when you're dealing in this field, you spend a lot of time talking to people who come up to you and say, I've got these problems, I've got these issues. And when you spend time talking to them, you sort of, it's almost like this pattern recognition about their behavior. You can sense it in them.
Yes.
You can sense that they're stressed. You can sense just the way they carry themselves, the way they're talking. And you almost start to feel stressed doing the talking with them, because it can be contagious.
This is something
And
that's
so
very
what
common in a very clinical setting for doctors
Mhm.
to see a patient like this come in. They come in with the list of their symptoms. They come in with the printed off list of all their supplements, or they come in with bags of the medications and supplements that they're taking. They're just seemingly on a very high stress level, and that is ultimately very true. It's a big component of why they're experiencing the issues that they are, sadly.
Yeah, and I think it's prevalent enough that everybody listening to this knows somebody who's like
Yeah.
that. Has dealt with people who are just, they're always amped up. They're always stressed. They're always complaining about something. They're always, and it doesn't even have to be something that it's about their physical health. It could just be something that they're just experiencing in life. They tend to catastrophize. They tend to um, always look at the what's wrong with the situation. Um, it's they don't have that positive mental outlook you really should cultivate
Yeah.
to keep yourself in a balanced state. Um, but let's spend the time right now to really dive into what we're talking about in terms of the medical conditions that
Yes.
are. I think of it as three levels. At the lowest level, the base level, we're talking about this autonomic dysfunction, this imbalance on that dimmer switch that you were talking about. It's pushed too much towards the bright lights and searing spotlight. Um, at the highest, two levels above that, you've got conditions like depression and anxiety and migraines and fatigue,
These are the labeled
widespread
diagnoses that
pain.
people
Yeah,
are given, yes.
fibromyalgia. Exactly. All of these medical conditions that have been diagnosed, but we know, especially the patients know, that if you have one of those conditions, for example, if you have anxiety, what is the likelihood that you also suffer with irritable bowel syndrome? Well, it turns out that the probability jumps dramatically. Instead of being, okay, 1 out of 12 people has irritable bowel syndrome symptoms. Okay, well, it turns out that it's like 1 out of 3
Uh-huh.
who has an anxiety condition. Fibromyalgia, some of those people, probably 70 or 80% of them also suffer with migraines. And you say, well, those are two different medical conditions. Why are they so related? Well, we know now, and we've talked about this before, we know that it's because they have this autonomic nervous system dysfunction. That's the underlying root cause. Okay. Now you say, okay, well, what's the middle level? What's that level in between that we can drive to and say, we got this dysfunction and we're going to treat it. We understand how to do that. But what are the things that, if you have these, it's, as I said, it's the warning light.
Mhm.
What's the warning light? And we can certainly point to things like personality, irritability, just challenging, a non-resilient
Yeah.
personality type. Those are things that are sort of obvious,
On the
but
personal development, kind of psychological understanding side of it, this comes down to the book Mindset by Carol Dweck, where you're either more towards the growth mindset or more towards a victim mindset. And for whatever reason there is, and I think there is a real psychological balancing point here that will drive people that are more in that victim mindset to experience and look for more of the negatives, look for more of the issues that they can complain about. And not to say that they're doing it purposefully, but that's just a
no.
pattern that they've created, and sadly they haven't been validated effectively by their clinical advisors and their doctors.
Yeah, and I think society, I mean, we talk about the effect of Western society on people. I think this is one of those situations where, some of that victim mindset and, not to get political, but some of the philosophies of sort of dividing people
Mhm.
is can lead to this sort of mindset that's negative, and we have to get away from
Very
that.
much
I
of
mean, there's a
me
lot.
against the world kind of mindset.
Yeah, or even sort of the identity
Mhm.
politics of I'm part of a small group that's being beaten up, and we have to challenge the rest of the rest of
Right.
society, as opposed to trying to figure out how we're all part of the same species. And but again, without getting political, what are some of the other symptoms? Because if you're just looking at a person's personality type, that can be very valuable, but it's also a bit soft. It's a bit qualitative, not
Right.
quantitative. And being a scientist, I'm looking for data
Mhm.
points. And so, what are some of the data points that we can look at? One of them is brain fog, this cognitive problem that people experience. It's one of the primary comorbid symptoms of a lot of of fibromyalgia, of depression.
Yes.
Depression. It's been widely written, especially over the last decade, that one of the key symptoms of depression is this brain fog, a cognitive dysfunction that comes with it. So that's another one. But again, that's getting closer to a quantitative thing that you can
Right.
measure. But more recently, there is a lot of work that's been done and published on each one of these medical conditions and its association with sleep
Mhm.
problems. We think about sleep and the importance of it. It's we always you and I always talk about the fact that it's the one that gets a lot of lip service, but not a lot of actual follow through.
That's exactly right.
People talk about their diet and they'll change their diet. They'll talk about exercise and they'll join a gym. They talk about sleep and they'll still stay up late. They're not actually going to follow through on that one, and it's really unfortunate because sleep turns out to be just very, very fundamental.
Yes.
And sleep disorders are associated with each one of these medical conditions, whether it's IBS or depression and anxiety or migraines or even asthma and allergies. You find that, or they're finding now, when they do sort of high level sleep analysis, that these people have disrupted sleep.
Yes.
And we're not talking about apnea or things like that, but we're talking about that their sleep architecture and the restfulness that they're achieving with sleep is insufficient.
Yeah.
They're not getting what they need.
So on the topic of sleep architecture, I, as many of our listeners know, am a big fan of wearable sleep and health trackers. I think this is a great way to get some of that data point in to be able to objectify some of the data as to what's actually happening while you're asleep. In the pretty common knowledge piece that while you're asleep, you truly don't know what's happening around you or in your body. You only truly can figure it out when you wake up. And even then, it's a very subjective, I got to check in and see how I'm doing with myself. And sadly, not enough people do that. And we're terrible at estimating or guessing how much we've slept, the style of sleep we've gotten, which, how much light versus REM versus deep sleep that somebody's gotten. That's where a lot of these data points and these sleep tracking devices can come in and be very, very effective in helping to actually show objectively what truly is happening during the night. Now, the nighttime piece is really important to understand. And we've talked about it a little bit, but I want to bring it back because people need to know that there's a few different things here. We need to go through 5 sleep cycles during a night of sleep. So, this is not new science. It's been brought up by many docs that have written books on these things. Matthew Walker most effectively did it in Why We Sleep, talking about the fact that we need to go through these 5 sleep cycles. One cycle of sleep is essentially going from an awake state or from a high level of or a high frequency sleep to a low frequency sleep. And so this is as we go down, we go through REM sleep very quickly initially, through the light stages and into deep sleep. And it's the frequency of the brain waves that determine then which stage of sleep that you go into. Now we need to go through a cycle where we dig down low into or close to deep sleep, and then back up into through light and into REM sleep. And we need to be able to go through that pattern 5 times through a full night. Now, each of these cycles can take anywhere between an hour 10 and an hour 35. Each person's a little bit different on this, and that's what dictates how much sleep each person truly needs to get at night, and that there is a variance. But on average, with that sleep cycle being around an hour and a half, hour and 25 minutes, with 7 or 5 of those cycles, then we're talking about a 7.5 hour window of sleep where sleep should be completed in. So that's the average time, but where we can get some data and say, hey, I've gone through 5 sleep cycles and it's only been 6 hours, that person has completed a full night of sleep, those 5 sleep cycles, in a shorter period of time.
Just to dive a little deeper, because it's really important to understand the differences within those 5 cycles. Okay.
Yes.
The first cycles of sleep have to deal with the critical, and this is literally mission critical for brain viability,
no question,
is the clearance of neurotoxic waste. And we had a whole episode about lymphatic clearance. I'll just summarize that very briefly, which is when you get down into that slow wave sleep that you're talking about, that deepest level of sleep, that's when there are some significant structural changes that happen in your brain. Okay. The space between neurons and the other cells that are in the brain, that space where there's fluid, okay, that's called the interstitial space. Okay. That interstitial space can actually change in volume. And the way it changes in volume is a group of cells called astrocytes, which are very important support cells for the neural structure. They change their volume. And as they change their volume, they do 2 things. They draw water out of, or fluid out of the bloodstream into, and it's actually cerebral spinal fluid. They call it the glymphatic flow. Okay. It increases the volume of the fluid. And then the slow wave motion, which is actually picked up also by the pulsing of the blood vessels, pushes, and in a wave, pushes that fluid through. So you're having not just more fluid to dilute all the toxins, the metabolic waste, but a flow. So it's carrying that toxic, neurotoxic waste into the venous structures or around the venous structures and pumped out of the brain into and collected in lymph nodes.
As well. It's a combination of the 2. Yes.
And so, exactly. But the reason I bring this up is because we're actually going to potentially test the levels of neurotoxic waste in the lymph in the neck. But yes, what we want to do is we want to push that fluid through there.
Yes.
It's just like dialysis, really. I mean, you're increasing the amount of fluid, the ratio of fluid to poison, to neurotoxic waste, and then you're continually washing it. Now, that happens in the early stages of sleep and dominates. That slow wave sleep dominates the first couple of cycles of sleep. Okay. But then, and there's relatively little
in the first 2 stages,
REM sleep during that, in the first 2 stages. But by the 3rd, 4th, and 5th stages, you've done most of the cleaning. And now you need the REM sleep. And this is the part where brain fog comes in, okay? Because yes, neurotoxic waste is dangerous, and brain function, I mean, seizure activity, headaches, pain problems, all of those things will build up and become problematic if you're not getting that clearance done, that neurotoxic waste out. In fact, neurodegenerative conditions develop as a result of that. But when you don't have your REM sleep, okay, what you're losing is the consolidation of memories. You're losing the consolidation of learning, the things that you learn. Think about it this way: it's like when you are, writing a program on a computer, or typing away at Microsoft Word, and you're building a document. If you don't save the document and convert it from where you were in just on the screen in RAM, and put it into a permanent saved state. If your computer turns off, you're not going to save it. Okay. So the same thing happens in the brain. If you don't go through the REM process and have enough REM sleep where you're consolidating and you're literally moving that information and that knowledge from one area of the brain to another area of the brain, and you're actually literally structurally changing the brain. If you don't go through that process, you're not going to learn, which is why over a relatively short number of days of this disrupted REM sleep, you're going to have cognitive deficits. And those cognitive deficits are going to be difficult to overcome because you've lost that information. And so it's really, really important that you have those 5 cycles of sleep, and if you can't get those 5 cycles of sleep, you got to figure out how to make that lymphatic flow more efficient, because there are people who are genetic short sleepers. And the reason for it appears to be because they have much more efficient lymphatic flow, potentially all the time. Potentially they are constantly in that state. And then you have people who need much more sleep. There are people who have sleeping sicknesses and things like that, where they're sleeping for 15 hours a day. We think that there's a possibility, at least among some of those, where it's because the lymphatic clearance is really impaired. Now, what impairs lymphatic clearance? Inflammation. Inflammation impairs the astrocytes' ability to create more interstitial space. It impairs their ability to draw more fluid out of the bloodstream and use it as cerebral spinal fluid to cleanse the area. So sleep is really important. And when you have inflammation and you're in a stressed state, you don't have that. In fact, I know I'm going on here with a lot of information, but one of the things that I find fascinating is the very neurotransmitters that are involved in alertness and in keeping you awake and preventing this lymphatic clearance are the neurotransmitters that are released when you're stressed.
Yeah.
Okay. It's norepinephrine. Norepinephrine is the sympathetic neurotransmitter. And so when norepinephrine levels are maintained at a high level, you aren't going to sleep well.
Yeah.
It's why you don't sleep well when you're stressed, or if something happened to you, you're going to have a fitful night's sleep the night after that because something bad happened to you and you're still in the threat response mode and your norepinephrine levels are high, and you just, that's why being burned out happens as a result
100%.
of
I
chronic
couldn't agree
stress.
with you more on that. One thing to remember here is that astrocytes are an immune cell. They are immune cells that make up the blood-brain barrier, and they dictate what comes into the interstitial area where the neurons are located, where the rest of the microglial cells are located. It's these astrocytes that truly dictate the flow of nutrients in, toxins in, whatever needs to get in. Now, you can imagine that because it's an immune cell, it has sensitivity to both the norepinephrine side of things, which is the sympathetic fight or flight style of signaling, and it has receptors for, and it's funny enough, the exact same type of receptor as many other immune cells, the alpha-7 nicotinic acetylcholine receptor that is present there. And so that means that it is also sensitive to acetylcholine. And what we need to do is we need to go through these cycles of being in sympathetic mode as necessary, pushing the accelerator as necessary, but then pushing the brakes as necessary as well. And that's where the acetylcholine, vagal nerve activation, and specifically in the brain, the nucleus bacillus of Maynard truly come in, where acetylcholine is then sent out to help to shift these astrocytes and microglial cells into more of that parasympathetic rest, digest, and recover and healing mode. And that's what enables that slow wave sleep to be as effective as it is. When we get into that deep sleep mode, like JP, like you said, it enables that slow, progressive dilution of the toxic waste in the interstitial fluid, that neural waste to be expelled via, again, those aquaporin 4 channels in these astrocytes into the venous tissues, into the meninges, and for that toxic built up fluid to then enter the lymphatic drainage and go down into the bloodstream to then be filtered out effectively. On the wearable device side of things, where there's a really strong, powerful component to sleep tracking is knowing what percentage of time you're spending in deep sleep versus light sleep versus REM sleep. And getting that data point is so, so powerful. In an ideal world, your sleep should look like this at the end of the night, where you're at 25% of your time is spent in a REM sleep state, 50% in light sleep, and 25% in deep. You want to be close to those ratios. Maybe a little bit less time in deep than REM, but essentially 25% deep, 25% REM. Around those numbers is where you truly want to be. You need to initially spend a quarter of the time activating that lymphatic drainage piece early in the night for the first 2 stages, and the REM sleep more effectively in the last 2 or 3 stages of sleep cycles, or those last 2 or 3 cycles of sleep. And that's where the consolidation of memory is going to occur, and the sorting and the planning and the preparation and the organization of these structural neuronal connections being built out. The light sleep piece is that rest, recover piece, more vaguely activating, more microglial activating, and allowing those to go into repair mode and healing mode so that we can clean up the tissues, the damage that's been occurring through the time that you were awake. Because generally, as we're awake, we're more sympathetic state. Melatonin kicks in. It has a very sympatholytic effect. So it shuts down the sympathetic nervous system. It doesn't enable or doesn't allow the sympathetic nervous system to turn on quite as strongly. That enables vagus nerve and parasympathetic activation to occur at a much higher level. And you can imagine if there is a dysfunction in the ability to turn on the vagus nerve at night, then you're going to have lymphatic drainage that isn't as good. You're going to have less consolidation of memories, and you're going to wake up that next morning feeling drained, feeling fatigued, and feeling foggy, not thinking clearly. That's exactly how this process occurs. And that's why sleep is so important and so overlooked and missed in so many of these chronic conditions.
Yeah, and I think that's the piece that's the next connection that I was going to make. So you jumped exactly to where I want to go, which is if you see in your sleep, if you're using the wearables and you see in your sleep scoring that you're not getting that, or you just know, listen, I only slept 4.5 hours last night. I only got 3 cycles. I'm shot. The next night. So what happens when you recover? Okay. When you recover the next night, that the brain viability requirement is going to mean that if you get those 5 cycles, you're not going to spend just the first 2 or 3 doing the brain clearance. It's going to bleed into 4 and 5, and you're going to spend more time. You're still going to, you're still going to have to clear out that waste. But it's going to take longer to do it. And as a result, you're not going to get the level of REM sleep that you need. And the consequence of that is you may feel rested. Your brain may actually function, but what you didn't do is consolidate the memories, and they're going to be lost. So, we always talk about, Alzheimer's being what a horrific disease, to lose your memories. Well, without sleeping properly, we're kind of doing that to ourselves. You're leading yourself in the direction of not being able to make memories. And that's horrible. I personally want to enjoy every moment of my life with my family and my friends and my career. I want to remember things. I don't want to have to do the same thing twice to learn something that, if I sat down and tried to learn it, I don't want to have to do that job again.
Exactly right.
Just because I didn't get enough sleep. So, that is, we know that this is the case because work that was done at the Defense Language Institute, where they took people who had to learn a new language. Okay, great. Now we can actually quantify it by looking at, okay, how fast did you learn it? How much did you remember? And how focused were you? There you are. Those are your major key aspects of cognitive function. Can you focus? Can you learn? Can you remember? What they found was that if you get your autonomic nervous system regulated properly, the benefits are profound. 30% better focus, 40% faster learning, and 50% better recall. Okay. How do you do that? Well, we've talked about it before. It's vagus nerve stimulation, but it doesn't have to be with an electronic device. I mean, in that setting, they used it because they wanted to be absolutely certain that they were getting the activation of the parasympathetic nervous system. They did it that way. But you can do it other ways. You can do it with, exercise and meditation and chanting and gargling and all of the other things that we talk about. But you have to do it. Okay. Can't just think about it. Can't just say, oh, yes, I know that information. You actually have to do it, because that's what's going to get your autonomic nervous system back into that rest, digest, and restore state so that you can sleep properly and you can learn and you can make those memories.
I'm
And you
going to
can
quote
enjoy
the
them for a lifetime.
Matrix here for a moment. Morpheus was a brilliant
Great
man,
move.
or at least his character was written brilliant. He said to Neo at one point, he said, Neo, sooner or later, you're going to learn there's a difference between knowing the path and walking it. Right? You may know what you're supposed to do. We all know that we should eat clean, that we should exercise, we should get great sleep. There's a big difference between knowing the path and walking it, doing what needs to be done. I notice this myself. If I am on point with my sleep and I'm making sure of it, and probably 70 to 80% of the time, that's what I'm doing. I'm upstairs 9 p.m., 9:30, ready to get myself into bed, and I get to sleep around 10, 9:30, 10 o'clock, somewhere in there, and I'll wake up very happily rested, ready to go at 5:15, 5:30 naturally. I do not use an alarm anymore. And that tells me that my body has gone through my 5 sleep cycles, and I can identify that utilizing my wearable health data, correlate how I feel with where my scores are. So now I've gamified this. Every morning I want to check to see how close do I feel to the number that's actually on there. So I'll wake up and I'll say, my sleep score feels like a 92 today. And more often than not, I'm close to that. And that is a nice little gamifying thing for me to say, you know what? The other day I didn't do this. I stayed up late. I was watching some movie or something. I stayed up late. I was maybe drinking water too late, and it affected my sleep because I woke up to go to the bathroom. Something affected this. And you know what? I had a 72 sleep score. Terrible.
So I'm going to tell you, because I'm on the other side of this with teenagers, there is a very big difference in the sleep requirements for children. And I would tell you 2 things. First, just for you personally, when your kids get to be teenagers, they change. When they go through puberty, there's a change in their needs for sleep. Young children always get up early. They get up bright
ask
and
my
early. They're
4-year-old
up.
to get up early. She hates
Adolescents like to sleep late. well, maybe she's
pushes
she's,
to stay up later at night.
what do you
That's
call it?
just her personality. Yes.
She's precocious. She's ahead of her time. But I'll tell you, kids, adolescents really do need to sleep later. They need that. And it's unfortunate because there's a lot of brain development that's happening in those later stages of sleep that I think the modern school schedule, which is designed around the work schedule and which is designed around farming and getting up early, is really unfortunate, because that's not the best way for kids to sleep. Once they get to high school, I mean, some jurisdictions are doing that, where they're having their sleep later, or the start times later for the adolescents. But I think it's unfortunate, because we really should move that, move the start time later for them to have that time to because think about all the things that they're having to learn. Think about how much they have to remember. Think about how much is going to have to get integrated into that neocortex.
Nearly as high on them early on in their lives when they're teenagers as it is when we accumulate over years and years and years.
Right. Well, that was going to be my second point, which is that all sleep is not equal. Okay. And natural sleep at the right times of your body's cycles is far better than sleep that's out of the natural cycle of when if you pulled an all-nighter and then sleep during the day, you did not get as refreshing a sleep, even though it may be the same number of hours. That's not good for you, which is why shift workers have much higher, if you work the night shift, I'm sorry, but you've got a
Mhm.
lot higher risks for metabolic disorders, for cognitive dysfunction, for neurodegenerative conditions, cardiovascular problems. All of these things are higher. Even though you may still be getting the best sleep you can,
Yeah.
it's not the best sleep for you. And then when you layer on things like, well, to get to sleep at night, I usually have a couple of drinks, a couple of alcoholic drinks.
May put you to
No,
sleep, but it's not giving you
no,
good
you
sleep by
may
any
fall
means.
asleep. No, that sleep is terrible sleep. You're actually doing exactly the opposite of what it is that you're hoping to do. Taking a melatonin, probably pretty good for you. Okay. Taking a whiskey sour, not so good. Not so good. Don't have the 3 martinis after dinner and think that that's going
Yeah,
to
it's
help you
just
sleep
knocking you out,
better. It's
but it's not
not.
actually giving you the opportunity to sleep truly and benefit from all the good that sleep does have to offer there for you. Let's talk a little bit about
Right.
autonomic dysfunction and other areas of the body, because I think this is an area that we've dug into quite a bit here on brain health, on brain function and sleep. Let's talk a little bit about gut health. Let's talk a little bit about the connections between uh, digestive or gastrointestinal style symptoms and other conditions that people have yet to truly put together. I think it's becoming more and more relevant for a lot of people, and it's being talked about quite a bit. We have a lot of gut brain axis connections or
Mhm.
gut connections to other areas in the body. But let's talk about some of the symptoms that people have yet to fully connect as being uh, pieces to this same puzzle.
Sure. I mean, it's everything from upper esophageal sphincter, dysfunction, hiccuping, and gastric reflux, et cetera, all the way through, digestive system problems in the colon and IBS symptoms, and whether it be, constipation or diarrheal. It's all. I mean, as you said, the brain gut axis is what they call the vagus nerve. 70% of the immune system is in the lining of the gut, and the immune system is tied to the vagus nerve and controlled by it. So, yes, but I'm going to turn this back to you because I have a question, which is, we talk a lot about the cycles. We talked about the circadian rhythms just before. We didn't call it that, but that's what we were talking about. There's all sorts of hormonal changes that happen during the day, cortisol cycles, et cetera.
Mhm.
The microbiome, and actually what makes up the microbiome, what the constituents are. I mean, those are, you know, tiny little bacteria that may only live for a few hours or and their populations change within a very short period of time. I mean, if you take a lot of sugar in versus a lot of, healthy
Yeah.
fats, you're going to see changes in your microbiome that
Yes.
occur rapidly. So, how does the microbiome change the changes in the microbiome during the day? How does it correlate with sleep? I mean, are there things that happen to the
You're
microbiome?
teeing it up here,
And
yes.
I'm sort of setting this here for you. Serotonin. Go ahead, because
I feel like
it's a
we
great
know each
topic
other
and
well
really,
enough
really
to
interesting.
know that you were teeing that one up for me. A big piece of the puzzle here is the serotonin piece. And this is where the microbiome plays a massive role. We know that 95% of our body's serotonin production, between 90 and 95%, happens in the gut and has everything to do with the 5-HT activation within the microbiome piece. So the population of bacteria that are present within your gut, and the microbiome is made up of, and we're talking gut microbiome here. Yes, we have oral microbiome, we have skin microbiome, we have lung microbiome. It's everywhere, it's all around us. We're talking right now just about the digestive tract microbiome. We need to have less bacteria in our small intestine and significantly more in our large intestine The microbiome plays a massive role on the signaling that goes via the vagus nerve up. We know that 80% of the signals on the vagus nerve are afferent signals, meaning they're coming from the organs going up to the brain. And there was a really interesting study that showed germ-free mice, which are bacteria-free, no microbiome, no bacterial population colonizing these mice, had virtually no vagal tone. And as soon as they were inoculated with a bacterial population, again, their vagal tone returned to normal. Really interesting study that showed this. So, vagus nerve is heavily and reliant on these microbiome inputs. We know that these inputs can be anything from GLP-1, GIP, incretin hormone based stretch receptors within the stomach, the pulsating and the biochemical inputs via the neuropod cells in the gut lining that are catching the biochemical components. So, noticing how much protein there is. GLP-1 gets signaled via the vagus nerve up to the brain. So, we know, yeah, we got enough protein. We're satiated, right? So that's going to play a massive role here. And the microbiome plays a very important role there. In particular, the population of Akkermansia muciniphila is the primary bacteria that's necessary on that GLP-1 side of things and the metabolic function piece. So Akkermansia, metabolic health, very, very strong link between those two. When it comes to serotonin, and serotonin then producing and being shifted towards melatonin within the body throughout the rest of the body, not necessarily the brain, but the rest of the body, melatonin production needs to occur. And serotonin converts to melatonin. So, what happens if you don't have enough serotonin production because your microbiome is dysbiotic or dysfunctional? What happens if you're not getting that serotonin production through the day? Well, your mood is off. You're going to feel dysregulated. You're going to feel off. You're going to have potentially gastrointestinal and other symptoms, and you don't then have enough conversion towards melatonin at night. What that does is it allows the sympathetic nervous system to stay on through the nighttime, essentially pushing our bodies into a state where we can't sleep effectively. We're not getting the benefit of a full, powerful, deep sleep. So when you go to sleep stressed and you haven't created that conversion of serotonin to melatonin, then you're not enabling your body to have a truly restful sleep. That is, I think, a huge piece. There isn't a direct consensus on exactly which bacterial population is there, but we know for a fact lactobacillus is a very important one when it comes to serotonin production. Noticing that you have Lactobacillus reuteri is a huge one. And then what's really interesting as well on the resilience piece, and something that I was talking to a friend, Dr. Sabine Hazen, who at some point will become a guest on our podcast. But Dr. Hazen has found that bifidobacteria in particular play a very, very important role in regulating neural health, brain health, and regulating brain patterns and brain waves, and that a low bifidobacterial population in a child is very strongly associated with ADD, ADHD, and autism. And we will talk a lot about that with her when she comes on as a guest on the podcast. So we know that there are certain populations. And so this is where gut microbiome testing, understanding what's truly living in your gut, ideally getting a shotgun-based microbiome test where necessary to note all of the pieces to the puzzle. What are the bacterial populations, but what else is happening? Are there viruses? Are there parasites in your gut? Are there worms? Are there fungi in your gut? Things that we shouldn't necessarily have in there can play a massive role on creating a leakiness in the gut, which triggers the inflammatory activation of everywhere else. If we have a leaky gut, we are generally leading ourselves to have a leakier brain. And that's where the astrocytes in the blood-brain barrier become more leaky, more sympathetically activated because they're in this inflammatory state. And that means that lymphatic drainage in the brain is going to be downplayed. So this is the piece that you were teeing me up for. I hope I knocked that out of the park for you there.
Yes, you did. You did. Somewhere in the stands, somebody's holding up a baseball.
Yes,
and
absolutely.
and hopefully giving it to a kid. Not, I think we've all seen
Yes.
that
The
clip.
Phillies lady, my God.
But anyway, at the end of the day, I think the primary message that I was really excited about this episode to talk about was the fact that there's this root cause of autonomic nervous system dysfunction. And there are, at a couple of levels above it, a series of different medical conditions that have previously been considered to be separate and independent, but people have identified that there's this comorbidity across them. And we've spent a lot of time talking about it, and I've done a lot of research showing that, in fact, those conditions are really not separate. They're symptoms of one underlying problem. But now we've recognized that there are some intermediate things that aren't necessarily medical conditions per se, but they are really bright warning signs that you are in that state where your autonomic nervous system is dysregulated, that you're in that fight or flight state way too much. And they are brain fog, they are sleep dysfunction, and there's also metabolic issues. We didn't spend a lot of time talking about that, other than sort of your you're talking about melatonin, and melatonin is a really important antioxidant in your mitochondria. And so your metabolism gets out of whack, and you end up with a lot of oxidative stress if you're not making the melatonin that you are when you're in a balanced state. And so dysregulated microbiome, dysregulated sleep, dysregulated cognitive function, and dysregulated personality, dysregulated mood, etc. Those things, even if they don't rise to the level of being anxiety or depression, but just sort of a hypervigilant personality type. These are all signs that you have an autonomic nervous system that's dysregulated, or is at least being forced into a dysregulated behavior pattern. And it makes you more susceptible to, and it may explain why you're experiencing the symptoms.
There's a few connections that I want to make for people here, and these are really important to note, that they're not necessarily two separate conditions, but rather the root cause of autonomic dysfunction here. If you have a single autoimmune condition, you have a 72% chance of having two or more another autoimmune diagnosis. That is a direct sign that there is an autonomic link here. It's autoimmune is immune dysregulation secondary to autonomic dysfunction. We know that there's a very strong link between type 2 diabetes and gastroparesis. Very, very strong link. But how could that possibly be, Dr. Navaz? One's a metabolic condition and one's a gastrointestinal condition. Aren't they different? No, the underlying piece here is autonomic dysfunction. There is a very, very strong link, JP, that you brought to my attention a long time ago, migraine and gastrointestinal IBS, IBD, that literally patients were going to their headache doctor on the 4th floor and going to their GI doctor on the 5th floor. And these two doctors were not talking to each other. But guess what? Autonomic dysfunction is linked to both. These are the types of...
And fixing
exactly.
it. And fixing it fixed
and
both
the last
problems.
one that I want to point out, fibromyalgia, chronic fatigue, and a very strong association with small intestinal bacterial overgrowth, something that I found in my practice, where the bacteria that should be in the large intestine have actually made their way into the small intestine. And if you've ever experienced or know somebody who's experienced SIBO, small intestinal bacterial overgrowth, that distension, the bloating, the challenge in the central gut here, why do you think that's happening? Well, isn't peristalsis and gut motion supposed to be unidirectional, going down the entirety of the tract in a unidirectional pattern so everything goes out the right way? Well, if you don't have a good, strong ileocecal valve, you don't have tone in your ileocecal valve because your vagus nerve is not signaling to your ileocecal valve, then the bacteria can backflow into the small intestine. And that's where a lot of recurrent SIBO is missed. Even if you're doing the antibiotics and you're doing the herbal antibacterial products, and you have to go through a second and a third and a fourth and a fifth cycle of these things, what you're actually missing is the vagus nerve and autonomic dysfunction piece that's underlying these conditions. Guess what? That's directly linked to fibromyalgia and chronic fatigue. Direct links between these connections. So
100%.
what we're trying to say here is, when you have these warning lights that are popping up, or you have these conditions that are seemingly unconnected and have no potential link between them, always think back to autonomic dysfunction as being the missing link between these two, because autonomic regulation sympathetic parasympathetic slider switch is often pushed heavily towards that sympathetic side, and we're not regulating going back and forth like we should be. We're not as resilient as we should be. And that's where a lot of these conditions are missed. And that's why when these doctors don't talk to each other, they don't get the results. Because these systems, these conditions, are talking to each other within our bodies. We are one clump of soup that everything is connecting and working together. And we're not these separate components or separate ingredients that have been put together. We are a single unit. The autonomic nervous system is the connecting unit, determining how the immune system functions in each organ of the body. I think that's probably the best way to kind of wrap this one up with a bow. Anything you want to add there?
No, I think you nailed it. I would just sort of emphasize the importance of becoming more resilient. All the things we talk about in terms of exercise and hormetic stresses that help you become more resilient. And remember that getting your personality or your mood to be more resilient doesn't necessarily mean you have to subject yourself to emotional stresses or mental stresses. You can do it physically. Just getting into the gym and doing some work in the gym can help you become more emotionally and psychologically resilient. So I just, and again, I'm going to put the plug in that Matthew Walker would put in, which is mind your sleep as much as you mind your diet and your exercise level. It is as important, if not more important. And if you are suffering with any of these conditions, I think the chances are you probably know that when you get a good night's sleep, you have a good day. When you have a bad night's sleep, it can be a bad day. So
a good day
make
tomorrow
sleep a priority.
begins with a great night of sleep tonight. That's the way that it starts. So I love that. I think this was a wonderful conversation. Thank you for suggesting the topic. I love it. For anyone out there who is experiencing these conditions or feels the need to explain this to somebody who you see is experiencing these conditions, it's a perfect episode to share with them. Send this out to 1, 2, 3 people who you think could utilize this information to experience upgraded health, and we'll catch you all on the next one.